Welcome back, everybody, to another episode of the Vitality Code podcast. I'm one of your hosts, Dr. Jason Farrah, along with the bearded wonder himself, Dr. Jeffrey Farrah, my co-host and brother. Hey, man.
Yes, sir.
How are things going in there in Tallahassee? Tally-ho.
Swampy.
Swamp ass.
110% humidity and 99 degrees.
Walk outside.
Rains every day.
And, instantly.
Ugh.
Just walk into a cloud of humidity. And
yes, it is.
I remember that from being. Brutal. It's similar to Ocala, the armpit of Florida. It was
Slow Cala.
Slow Cala, yeah.
South Carolina can't be that much better, though, is it? Well, I guess you got the beach breeze blowing, so maybe it makes it a little better.
But a little bit inland where we are. We're just a little bit inland from the actual beach. It's like bleh. And we literally live in a development. I don't want to say the name of it, but it
is a swamp.
It is. Like it was developed like in wetlands actually, and so yeah, man, I got deer flies and horse flies and like swamp.
Oh, I can't stand that. When we go out to Bristol, the horse flies and the yellow flies.
Yeah, those biting flies, they're no joke, man. they will tear
They're
you
vicious
up.
Little guys, man.
They're vicious, man.
Yes.
That's a public service announcement.
That's why
there.
people from people out north or out west come out here. They're like, the bugs are ridiculous. I think we forget just what like pestilence there is here.
Dude, Florida and the southern state, Louisiana, South Carolina, they have.
I bet Louisiana's worse.
Oh, dude, some weird, palmetto bugs. The swamp, dude. It's like the South, the dirty South. It's
the gators. Who cares about the gators? It's the palmetto bugs and the horse flies and the yellow flies.
Nasty. Yeah, I went out last night to get the
I saw a gator on the side of the road the other day.
A gator?
Never seen that before. Dead on the highway. Gator on the highway. I was coming home on down I-10. It was a dead gator.
Wow.
I was like, damn, yeah, Florida. That's the first one for me.
So, yeah. Any new things going on in the clinic there?
I know what you're hitting at. My recent trip out to
foray into psychedelics.
My recent trip out to Colorado. Yeah, man. We just got back from Colorado. Speaking of,
some people call it Special K, Super K, Vitamin K. Is it a miracle drug to treat depression, or is it substance use? Is it a drug to put people and animals under during surgery and control pain, or is it something for recreational? What's ketamine, dude? And, hey, let me tell you. So I don't know if I told you the story. So in my role as a trauma critical care surgeon and multiple hats worn during that phase of my career, we use ketamine a lot for conscious sedation, obviously. And I remember, I think I told you the story, how I had a patient who said, don't call it ketamine, it's Ketamine-Nice. She loved it. And every time we would do this, just Ketamine-Nice.
I'm going to use that.
So what happened out there in Colorado? Are you a different man now that you've come back from the psychedelic?
Yeah, honestly, I am. It was great. That was my first. Yes, I went to the Psychedelic Research and Training Institute, PRATI, and did a psychedelic training program.
What's it called,
PRATI? For PRATI, P-R-A-P-R-A-T-I. That's the acronym, and it was practitioners. So it was probably 30 of us out there. Psychiatrist was the biggest, which makes sense now. I was one of the only non-psychiatrists out there.
Really? There's a bunch of psychiatrists.
But looking back, which makes sense, given its use in medicine today. But I, unbeknownst, didn't think, and I was like, oh, so what do you do? Then like psychiatrist. What do you do? Psychiatrist. What do you do? Therapist, psychiatrist. And I started looking around, like, oh shit, I'm the only non-psychiatrist out here. Wow.
What do you do? Functional medicine, chiropractic, CrossFit,
hormone
replacement therapy.
Replacement. They're like, oh, you're weird. They're all wearing their hippie garb, and I got my jujitsu shirt on. I was definitely an outlier.
There was a lot of tie-dye shirts and patchouli burning in the background. And
to a certain degree.
Birkenstock sandals.
And I think... And the South is different than the West. If you didn't know that,
that's an understatement.
Yeah, so I got to get woke for a good weekend too, so that was fun.
You get to get
yeah. So I went and got
woke. Yeah,
woke. I went woke, man.
Woke, yeah.
They asked me my pronouns, and I was like,
Did they
Jeff?
really?
I
No,
don't-
they didn't ask you that. Did they really ask you that?
Yes.
Oh my
Are
gosh.
you kidding me? That
Wow.
was the starter question. I don't, and I guess I'm gonna say it, but I know whatever, controversial. Who gives a shit? I don't even know. But there is something called your social location. I don't know if you're familiar with your social location.
Wait, I want to just stop you right now. Here's the problem with this. I'm not a person that wants to be mean to anybody, and I don't want anybody mean to me. I want to let people do their own thing, and I want people to let me do it, and not as long as it's not hurting anybody. But at the same time, freaking A, man. Like my biggest beef with all this is that it's too much work. It's too much damn work. Like I can't keep track of all this
you
stuff.
have no idea.
I have a
You
hard
have
time.
no idea.
Yeah, I have a
I'm
hard
about
time
to blow your
keeping up.
mind.
Keep it up with my kids.
So, I'll
Pokemon
give you-
names.
I'll
I
give you-
can't keep track of all these other friggin' names for all these other people.
I'll give you an
Jeez.
example of someone's social location. If you thought pronouns were too much, social location is probably
location.
like, think of like 10 identifiers that identify you. It's the most self-indulgent exercise. So an example of a social location would go something like this.
Oh, I'm a husband. I'm a surgeon.
Hello, my name is Jeff. I'm a cisgendered, able-bodied, male-identifying person. I reside in lands of the Seminole tribe. I am married to a educationally privileged woman who we both attended Florida State. I have the educational privilege of a doctorate, and I have a long COVID sufferer and a it just goes like you and those. I was not being silly there. I was giving you literal examples, but like give another 15, and I'm like, I forgot your name. You know, I'm raising my hand in the back. I'm like,
Wait, can we
was
just go
it
back to your
Jane
name?
or was it? It was a good exercise for me. And then they're like, say to go down the room, and I was like, shit, I froze. I'm like, I'm Jeff. I'm from Florida. They're like, who's the noob over there?
Yeah, exactly.
We don't
They're
even
all like
know
looking.
who he likes to have sex with.
Oh, how dare
How are we supposed to
you.
relate to you if we don't know who you have sex with? It was, I tried my best to
gosh.
fit in. I did good. I mean, they're great people. It was, it's funny because
It's all
we're going
well
down-
intended.
the last thing I'll say is on an individual basis, the people were amazing. But when those things become collective, it's like, Jesus. But the individuals are great. Like you talk to that
Yeah,
same person.
that's the whole
who
problem with
we're
that. It becomes
poking fun at,
collectivism.
and I talked to him like, "You're an awesome person. You're cool. You're great. You have great clinical experience. You have great personal things. We jive." But when it becomes this big collective thing, I was like, "Oh God, I don't know if I'm down with this." But anyway, so yeah, so we. And it was also psychedelic, so it wasn't it wasn't a 9mm competition in North Florida at the Coon Bottom Gun Ranch. You know what I mean? So I had to kind of understand what I was getting into.
Boy.
I think it's funny that I can float between the both of those. I'm comfortable in either scenario. So
You're a social chameleon. You can.
there you go. And I would make fun of the Coon Bottom people too. When I drop my deer off, I'm like, man, that guy was, whew. Like there was,
Boy,
I say
no.
the same, poke fun at those people too. So, I'm fair in my, and myself, I include myself in those things. But yeah, so nonetheless, it was a psychedelic, it was like a retreat. It was a educational experience, but it was in a retreat format. So we were all providers, either therapists or prescribers, and we were learning about it was an experiential training to learn how to administer ketamine as well as have an experience ourselves. And it was a 4-day conference.
Which came first, the learning how to administer or the experiential?
Yeah, interesting. So we did day 1 was didactic, and day 2 and 3 were trips.
Oh, you took
Mixed with
you took
didactic.
2 trips.
I took 2 trips. Yep, I did mine. I went out there. It was 4th of July weekend, so I think I went out Thursday,
Woo!
which is
America.
funny.
Bringing in
I was seeing stars, baby.
yeah, literally.
I flew in. I want to say I flew in on, I forget the exact days. Wednesday. Learned on Thursday. Tripped on Friday. Woke up Saturday morning. Did another trip. Learned the remainder of Saturday and Sunday.
Back to back. Why
it
back
was
to back
awesome.
trips?
Yeah, that's a good question. I don't know, and my fear going into it was because I did mine. like 7 p.m. and then the next morning at like 10 a.m. And by 10 a.m. I was like, geez, I don't know, man. I'm still just coming. I'm pretty sensitive to medications, personal history, my social location, as I'm pretty sensitive to medications. Like you give me 12 and a half of diphenhydramine and you might as well turn the lights off and just see me tomorrow. Like I'm super sensitive. Doesn't take much. So I was still feeling some of the effects of the ketamine the night before. My fear was that,
if Stacy wants to take advantage of you, all she got to do is slip you a Benadryl.
Yeah, baby. I take the kids' dose. I take their Benadryl. So, yeah, I was scared, but the second trip cleared it out, is what I would say.
Really?
I'm glad I did the second trip, and I'm glad I did it the next day. It almost, I don't know how to describe it. It almost finished anything residual and cleared it out, and it didn't have an additive effect during the trip, but it had an additive effect in my overall experience and the overall impact of the weekend at large. So I think they knew what they were doing to some degree, unless it just worked that way for me. But yeah,
So,
it's almost like they had done this before.
Yeah, well, I should hope so. What? So when you did the didactics, tell us here in the studio and everybody out there in the audience, what is ketamine?
So ketamine, and I've relied on you somewhat to your comfortability and use with ketamine, but ketamine is a dissociative anesthetic that is used. You would tell me, is it clarified for procedures? I mean, or would you even say the word surgery, or how would you?
Vets use it
How
for
would you
surgery.
classify its
I
use?
think it may be used adjunctively during surgey.
There you go, adjunctively. I like that. Yeah.
But
procedures, right? That would be the way I describe it.
yeah, I would say in the way I've seen it used in the acute care setting in the hospital is intensive care units for bedside procedures and or intubation. Although it'd be
There you go,
less
bedside procedures.
and then in the emergency room for a very similar conscious sedation.
Conscious sedation. There you go. Yeah, that's good.
People at home might call that twilight. Something like it's not completely general anesthetic, although I guess you could do a general anesthetic, a total intravenous anesthesia with ketamine. But those are nuances and definitions that probably wouldn't really matter to most.
Yeah,
people.
from my understanding, ketamine was originally developed in the military for on-field surgery during Vietnam. Because of its portability, its ease. That's the original.
Wasn't it originally? I thought it was originally a horse tranquilizer, or quote unquote.
Yeah, I don't know. Maybe in its original medical use. Maybe before that, it was in the veterinary world. But it's a dissociative. It's sedation, as I understand it, and I've not used it like you have in that regard. But it disassociates you from the procedure, so to speak.
Right.
And
it has you're awake, but you're disassociated from reality, and rather than being unconscious per se,
right,
you just get detached.
And
from
it
reality.
is analgesic as well. Like it does have some pain
it's a great
inhibition.
It's a very good analgesic. Yeah.
Yeah.
Okay.
So it's interesting.
Yeah.
But I think one of the big things I learned about ketamine, because obviously we grew up together, and I don't know if we know each other's drug use, if we want to call it that. But I've never done any psychedelics. I've never done any.
Yeah, I got a short list, so it won't be easy to know.
Yeah, I got a zero list. Like I really had nothing. We grew up pretty conservative. We grew up a Reagan era product of say no to drugs, and I thought everything. If you looked at a cigarette, you're going to end up as a coke addict, and but so I think I was just scared. Plus, we had fairly conservative upbringing, so I was scared there. So I've never done anything, so I didn't really know what to expect. And psychedelics, to me, ketamine's a little different. It's not maybe a classic psychedelic. It's not a plant-based. It's a synthetic, man-made molecule. So it's not a psilocybin. It's not ayahuasca. It's not DMT. Yeah, it's not found in nature. So I guess in that sense, maybe it's not a classic psychedelic if you want, but I had a psychedelic experience by all definitions of psychedelic experience.
Okay, so what's the psychedelic experience?
So I went to a different world. Yeah, so I went somewhere out of my body.
You paused for a second. Wait, was it like, what were you thinking in that pause? How do I describe this?
I think one of the which is a classic description of psychedelics is they're hard to put into your current vocabulary because their experience is past your understanding of the reality, i.e.,
bounds of what what in reality is for you.
the bounds of my communication is. So it's hard to even put into words, and that is a classic example of a psychedelic trip. But in layman's terms, I went to another world, so to speak. I was still present and I was still Jeff, but I was nothing more than a conscious expression of just Jeff. I did not have a bodily form, so to speak. I was just a floating consciousness.
The thing that fascinates me, and I don't know if you can put this into words, but is when people talk about it, I always wonder, am I hearing their retrospective analysis of what they experienced? And I guess by definition, there has to be some of that, but how much of that you're telling us were you consciously experiencing is not the right way to say it per se, but do you think, I mean, could you comprehend in the moment that, and I know there's the bias of the retrospective scope, just because we didn't record this while you're under the influence, but as best you can tell, could you tell that you were during it, that you were like, oh my gosh, this is crazy, or is it more of you just kind of trying to?
Could I tell you, or was I just experiencing it?
Yeah.
Well,
yeah, sort of. I guess
it's a good question. I don't know if I fully understand the question, but I was aware that
I don't either. I'm trying to figure out
Yeah. And I think this is part and parcel of sometimes with psychedelics, included in breath work, I would include in that, is like part of what they tell you is be careful who you tell, because it's hard to understand, and it can sometimes taint the experience because people are like, I don't understand what you mean. Then you find yourself trying to explain it. And I'm not saying you're doing something wrong, but I was transported outside of my body and outside of my reality to a positive place, and I still had human emotion attached to it, so I was still grounded enough to attach things like, this is nice, this is good, this feels positive, I'm experiencing it. I still had those conscious levels of thought, so it wasn't completely disassociated.
Can you articulate?
But hard to even put. It's difficult. I think the one way I explain it to people is like, from what I understand, never done psilocybin, never done LSD, never done DMT, any of that. But those benefits are experienced in the trip. Meaning, from what I understand, again, from a non-experiential standpoint, is that the benefit of doing psilocybin is in the experience of the trip. However, ketamine is different. The psychological benefit, because what I did was psychotherapy-assisted ketamine was the model, not the biological model.
I thought you just took a trip, and that you're saying that trip did something chemically to the structure of your brain.
Yeah, no. I think it did somewhat, but that's not that. It was the processing that I was then able to access that was the benefit. So as I understand it, the benefit of ketamine is coming out of the trip. There is a biological basis to this. So you have two models. You have a biological model, which means we use ketamine as a drug for depression. It's just a drug you take. Here's the monograph. You take point this per kilogram of this, and you take it this many times, and you get this benefit, right? But there's a lack of durability in that approach that seems to be a stopping point. Now, again, if you're suffering from severe depression, you get 2 weeks benefit. You may not care about 6 weeks of permanence, right? You get 2 weeks of benefit, and that's of value to you. So I'm not diminishing that. Okay. But the other model is then to use ketamine as a means to achieve benefit after the ketamine, outside of the biological, in addition to the biological model, which is psychotherapy-assisted ketamine. Ketamine is assisting your psychotherapy work. And so that was the model that we were learning under. So for me, it was the processing after the ketamine and the access that I was given to my internal processing that ketamine allowed me to access. That was the benefit.
Without being...
And the trip was fun.
Without being too personal... Well, that's a good thing. Without, because I would be worried that I'd have a bad trip or something, go to the K-hole or something. Without being too personal, or if you want to be, but help. Can you articulate that? And so, a couple questions during the trip.
Real world terms, what that means.
But during during the trip, were you guided in some kind of meditation, like people asking you questions? I saw on this Netflix special called Change Your Mind, which was, I think, is an excellent documentary on psychedelic use in psychotherapy, and and kind of bringing into more mainstream its use other than recreational for therapeutic use. Okay. You said you could access things or process things or see new perspective on things in your life. Was that through a series of questions that somebody asked you after the trip to evoke your new state to find these answers, or did they kind of come to you, or is this your own take on it, or where was the therapy aspect as well into this? Was somebody?
Sure. So I think that all of those examples are possible. For me, in my experience, I explain it this way. One of the things ketamine does, and this kind of helps understand how the benefit of ketamine is coming out of the trip, not in the trip, is ketamine shuts off what's called your default mode network, which is which is the parts of your brain and your mental processing that are on point and are firing during your passive tasks. So those tend to become less pronounced in tasks that require lots of external thought and external processing outside of internal just mechanisms. So what that means in psychological terms is your default mode network for you, Jason, would be how Jason defines himself and how he interacts with me as your brother, and how you see yourself and how you see yourself to me, and you see yourself as a father and as a husband and as a clinician, and those default mode ways that you interact with yourself. And so I would put that into terms like this. Let's say you suffer from a lot of anxiety. And a lot of anxiety, people start to use terminology like, I am an anxious person, I have anxiety, I am anxious. When you disassociate under ketamine, that part of you goes away. It shuts off. You are no longer, you're just so unassociated with yourself that you no longer have anxiety because you don't have anything, right? So it all shuts off. When you come out of the ketamine, those mental processes start to fire back up, and you now see them fire back up from a literal sense, in a psychedelic sense, but also from a figurative emotional sense, where like, oh, my anxiety is coming back. It allows you to see it, and it allows you to have a different relationship with it, and it allows you to potentially interact with it differently. Correct. And so the example that makes sense, have you seen Inside Out 2 or Inside Out, the movies at all?
Yeah.
Yeah, so those characters that are one's sadness, one's embarrassment, they aren't the person. They are characters who live in her brain, and they make her up, but they aren't her. I think a lot of people who have severe depression, anxiety, they start to associate with I am anxiety. Not that I have anxiety, I just am anxious, right? But you see those things, they fire up, and you see the mental thought processes that go along with it, and you might look at it and be like, oh, shit, I'm not anxious, I have anxiety maybe. I have anxiety, and here's how it manifests, here's how it affects me, here's how I felt without it. Depression may be another example. And so I'm not depressed, I have depressive thoughts, and here's how they manifest, and here's how they look, and here's how they interact with the other parts of me. And you are then afforded a different way. This was my experience, is then you are afforded a moment of time, a moment of like mental plasticity, so to speak, where you can then determine, I will interact with those thoughts and those mental processes in that default mode network differently, and I may decide to change them because I now see them from a different perspective. I now see them in a different light, and I can choose to work on them or address them differently or interact with them differently. So for me, that manifested in a familial relationship interaction. The ways that I interact with my family were the specific default mode networks that came to me in this moment. I didn't go into it with a specific intention. A lot of people do that, and a lot of people say they have some issues they want to work on. I just was there for the experience. But the specific things that came to me were familial interactions with which I had been thinking and had been working on and had been processing through normal means, whether psychotherapy, whether just thought and meditation and active change. And I was able to see them from a different perspective and able to garner such clarity and such realization and such insight that it manifested in a significant change in my life that was what I would akin to several years of therapy.
But it's interesting that I don't know, but that thing that you had, that relationship or that thing that you had, or relationships that you had enlightenment on, seems to have been a pretty dominant player in your mental landscape. And that was the thing that kind of came up during this. Or is it?
Yeah,
is
it's
it,
something else been on my mind.
Yeah. Interesting that was a...
I wouldn't say they were excessively dominant, but they were current concepts that I was currently working through. Yes. And so I think for me, that's where, now, under the biological model, I just felt good. I'll say that. Like, there was this like levity that came to me. There was this feeling of just change and lightness and happiness that was the product that was different than the mental processes. I just felt really good. Like, the experience was positive. The trip was really fun and beneficial, and I enjoyed it. And how I felt afterwards for it's been about 2 weeks. For that 2 weeks, I feel it wearing off, believe it or not, a little bit. That sort of lightness and that brevity, that was beneficial. The things that I garnered, the insights that I gained, don't feel worn off. The insights that I was able to elaborate from that experience don't feel unchanged. So I think there's two benefits to it, and that kind of fits with the research. There was a little bit of durability problem with using ketamine as a strict drug-based benefit, right? Not outside of the therapeutic mindset. It doesn't last. Nothing lasts forever, but it doesn't last long. And I don't know how you define the word long, but that is a known problem with ketamine.
What doesn't last long? The high or the change? I mean, there's not neurologic remodeling that goes on, or
the change? Like, so you use this, you taking a specifically depressed person who's struggling with chronic depression. Their depression is not alleviated from a ketamine trip for, I don't know how you define significant, but not months, not years. It's days and weeks. And so the typical biological model is 6 to 8 treatments over 2 weeks of an IV therapy. There seems to be a response there's a big response to people in the initial treatment. There's some people who are responders in that 4 to 5. That's the next biggest group. You see responders after 4 to 5 treatments. So most of the treatment protocols that I see are 6 to 8 to garner a majority of responders, because we don't know if you're going to be a single response. And there seems to be an additive effect as well. So you might get 6 months of benefit from 6 trips over 2 weeks in an IV biological model, which, if you struggle from severe depression and you're suicidal, 6 months may be worth its weight in gold. So I'm not diminishing that. But I think without the work, I don't know that there will be lasting change without the psychotherapy. And so under that model, it looks like the window of plasticity is about 72 hours. So maybe within that 72-hour framework, I would then, maybe in my specific example, I would sit there and talk to a therapist about some of those insights that I gained and what they mean and how I see things differently, and further process those from a traditional talk therapy standpoint. That's what the talk, and you might do that in the moment after the trip, or you might do it the next day, or that 72-hour window seems to be the sweet spot.
So how would you use this? How would you use this in clinic, and how do you plan on? Are you bringing it to your clinic, and what will that look like?
That's interesting. So I think I will use it. I told somebody, so I have a quote-unquote team of people that I'm consulting as I bring this, because I'm not a psychiatrist. So I have a psychologist. I have some people that I am going to sort of inner circle to consult, because I want to take this. I don't want to take this lightly and just like open a clinic and, oh, everyone needs this. But I also told them I feel selfish if I didn't give this access to other people. That's how influential it was to me, that I feel that it would be a disservice to people if I didn't then, because I'm able to bring this, because it is a controlled substance, because you have to have certain training, outside of the recreational standpoints, of course, to do this, that it seems almost selfish and detrimental to not allow people to do that. So how I will do that, I don't know exactly. I'm not a psychiatrist. I don't see myself working with suicidal patients. There are people who are called to do that and who are skilled to do that and who use ketamine for that. You might, instead of putting somebody under a 72-hour Baker Act, you might give them an infusion of ketamine that makes them feel good for 72 hours, and then they can then be settled and seek help. You might use this for a severely drug-resistant depression person who has not seen any benefit from any of the standard models of SSRIs and other drugs that are available now. And this might be part of their regimen. I don't know that that's my calling. I think I see it differently. I think I see it from, for lack of a better word, more people like me. Like, I wouldn't call myself severely depressed or severely anxious, but I had anxious things and I have anxiety at points in my life, and it seemed to allow me a breakthrough that would be quite beneficial to me, and I saw value in, even though I wasn't psychologically compromised to the state that traditional medicine would deem valuable to treat. Meaning, I'm not suicidal, so psychiatry is like, well, then we have nothing for you. And I'm not drinking and I'm not alcoholic. But, like my family relationships that I talked about, it wasn't that we were fighting all day and we were, this is bad and this is not, but that doesn't mean they can't be better. And so it allowed me to achieve a better, and that seemed of value to me, and that seemed of value, I think, to other people. And I think it was also fun. I told Mike, specifically Mike Zoda, I'm like, no offense, dude, but like working with you to gain insights which have been beneficial to me beyond anything else, they're just slow and painful, man. True talk therapy psychotherapy is not fun, and it's arduous and it's long, and ketamine was it was quick and it was fun. Like, I got to trip. That was my price of entry for benefit. Yeah, it almost felt like a cheat code. Like, I got to trip, and that was great. And then because I tripped, I got some insight.